Good morning and welcome to today's Dr. Anyoha's podcast. Today I am going to be talking about infants and children mental health. That is the inner well-being of children and infants and young adults. What do I mean by mental health of children? I mean talking about their happiness, their ability to express their emotions, smile back to their parents, laugh, talk, say goodbye, good night, hug, and feels empathy. Those things have to do with mental health, relating to others, playing with others, expressing their emotions, and so on and so forth. How do we enhance that? These are the social, emotional health of children. And they don't just come with birth of a baby. No, the babies learn this. Children learn to express themselves. They learn to socialize. And they learn to express their emotions. To be certain, when a newborn baby is born, especially if you've been to labor and delivery where babies are born, babies do feel pain and they cry and sometimes they smile, but those are reflexes transferred to the baby through evolution. All right, those are reflexes. This is not what I'm talking about. I'm talking about the learned expressions of giving hugs, kisses, happiness, joy, and being able to play with others and express emotions. So these are learned from parents and caregivers. In the 17th century, that is between 1600 to 1700, it was thought that babies don't have any feelings at all, that babies just don't care, they don't have any feelings. There was a debate whether babies actually do have feelings. Do babies have feelings? Do they care? We were debating that in the 17th century, whether babies have feelings. And then there was a shift in the 20th century, that is between 1950 and year 2000, when it becomes clear to scientists and people who study babies that the babies do have feelings. They have interest in socializing and relating with people around them, and that they express themselves. They're very disturbed or perturbed if the parents don't reciprocate their social overtures. Right? If the baby is smiling at you and you don't smile back, the baby becomes upset. So that has been proven. Okay, so people then started noticing that babies have strong feelings and they want to relate with whoever is caring for them. They want to express their emotions, right? They want to relate to others, communicate. Okay, that was not long ago, about actually 200 years ago. But right now, currently, in year 2024 and the last years, the emphasis is now on how to enhance that inner well-being of babies, infants, and children. How do we enhance that feelings to socialize and relate to others and to caregivers? How do we help them, bring out that emotional capacity to relate, and express their feelings? And whether it is good feelings like joy, smiling, kissing, hugging, showing empathy, or upset, being upset, crying, and expressing their feelings. People express emotions, can be negative or positive. It can't be always positive, but you have to express it. We have to teach the infants, children to express their emotions, and that starts very early when they are born. From the time of birth, you don't have to wait until the baby is 2 months to begin to tap into their feelings and notice their feelings. Now, why is this important? Why is noticing babies' feeling very important? Why is helping babies express their emotion important? It is important because the inner well-being of infants, babies, and children are the foundation for talking, language acquisition, further brain development. So this is very important stuff. When you relate with your newborns, infants, and children, it helps them with their inner well-being and also organize their brain to learn to speak and to acquire knowledge. So this is very, very important. And the parents, the caregivers are very important in this quest, in these goals and objectives for infants and newborns to acquire social emotional health, for their inner well-being. Parents are very important. Paying attention. It all boils down to paying attention to the babies. That's how it boils down. Paying attention to the newborns, paying attention to their needs, paying attention to their feelings, recognizing that they have feelings and meeting their needs is the way to relate to them, to tell them that you care. And that would translate into social emotional well-being, infants, baby, and children. Showing them that you care in their daily needs, picking them up, feeding them, changing them, clothing them, making sure they have a good environment to sleep, coming to their rescue if they're crying, feeding them on time, setting a routine, and meeting the routine. This parental behavior would over time create bonding, understanding, and trust. And that is very instrumental in mental health well-being of infants, babies, and children. Remember what I said. The reason why this is important is because this is the foundation upon which language acquisition is based, speaking is based, learning is based, and acquiring knowledge, cognitive development, and brain development. Thank you so much. Please share the video or the podcast with your friends and family.